For the 30 million adults in the United States living with chronic obstructive pulmonary disease, or COPD, day-to-day activities can be a big struggle.
Yeah, we'll be hearing from Dr. Raj Dasgupta on how patients can manage their disease.
But first, let's meet Chuck, once an avid golfer who is able to pick up his clubs again thanks to full cycle breathing technology. That's great news. Take a look.
I grew up in South Florida, retired from the banking business, moved up to Claremont here with the idea to play golf every day. We have friends here that we barbecue, go out to dinner with, things like that. Always had asthma as long as I can remember. I was in and out of the hospital a lot as a child, and it got worse towards about 50 years old. They diagnosed me with COPD. Then I went into emphysema, and my quality of life deteriorated quite a bit.
When we talk about here in the United States, almost 150,000 people have died and suffered from COPD. It is a chronic respiratory disorder. It's about severe airflow limitations, meaning they can't get air in, and when we talk about obstructive lung disease, they really can't even get the air out. They could have fatigue, they could have weight loss, cough, mucus production, shortness of breath, and of course, especially if there's an asthma component, wheezing. So depending upon the severity of COPD, it can definitely affect things at home, things at work. It definitely affects your lifestyle, multiple admissions to the hospital and the emergency department. And needless to say that besides the organs in the body, talking about the heart, talking about the effects on the lung, it can definitely cause depression. It can cause anxiety. It can cause people to be isolated at home. So COPD can take a toll on every aspect of a patient's life.
Well, the COPD was just a word to me until it started affecting my life and as to what I could do. I would run out of air much faster. My condition kept progressing, and I had a lot of infections and flare-ups. Then I started with the various bouts with pneumonia and that in the hospital.
As his condition continued to progress, a new reality for Chuck set in, using supplemental oxygen 24/7.
I still tried to play golf and did play golf. I cut down the number of days. I played golf for 2 years, and then I went through my final 2 big bouts with infections and pneumonia in the hospital, and I had to quit golfing. Was able to get around a little bit. I mean, we did do some card playing. That's pretty much all we did. A little chess now and then. Well, it's kind of depressing to go immediately into fairly active to not doing anything at all. I needed to do something to get better somehow.
So the key part is, after they get the diagnosis, is to have shared decision making. Make sure I understand what they want to accomplish, what are their limitations. And I feel that after they get this diagnosis, in most cases, they shouldn't have to change their lives. They could still go out and see their friends and see their families. If they want to do simple things like going to the grocery store, this can be done. And especially now that we have many new options to offer different people at different stages of the disease, this is something where people could have a positive attitude going forward carrying this diagnosis. So when we talk about COPD and treatment, one of the most important things to start these patients on is pulmonary rehab. They help you exercise. They help you understand your disease state. They help you understand the breathing techniques, because there is data that patients who are sedentary will have a higher risk of infections, have a higher risk of exacerbations. So encouraging movement is one of the core things I promote in my COPD patients. And for patients who have multiple exacerbations, I'm very happy as a clinician that there are medications to reduce these exacerbations. And unfortunately, many of my patients may need supplemental oxygen.
As COPD progresses, the muscles that support natural ventilation have to work harder.
Full cycle breathing can help patients both breathe in more oxygen and then expel CO2, giving those fatigued muscles a rest.
Thus, less shortness of breath and more energy to remain active.
There's a certain stage where patients can't keep up with their own ventilatory needs. And when this happens, they need assistance. And this can be done in 2 ways. It can be done invasively, where unfortunately there are individuals in the ICU that have a tube past the vocal cords. We also have non-invasive ventilation through an interface such as a mask, whether it covers the nose or the mouth and nose. And it's amazing when we talk about the non-invasive, there are devices out there that can help patients with COPD be mobile. And that's always going to be a very important part.
Even with oxygen, you're still going to have difficulty breathing. At least I did. So I talked to the doctor. I says, is there anything else I can do? Rid of this tightness in my chest all the time. And they said, well, the best thing for you then is to get you into a breathing machine. I was thinking to myself, oh boy, you know, I've got to wear a breathing machine. And well, it turned out that wasn't it at all. So the Life2000 came around. Well, the trainer came out right away and hooked me up immediately, showed me how to use it. It's very easy to use, really it is. Glad it doesn't have a mask. The nasal cannulas they give you have a pillow interface, so they're even easier to use than this thing. Makes it very comfortable. With the Life2000 on, I can walk a lot farther. Play some golf, of course. I'm getting to play more and more holes. So it's really great to know that you've been released from this prison, you know. You're able to actually get out and do something. And if I hook it to the portable tank, we do our walking with that. Really nice to be able to get some exercising in. You know, you get to where you're not exercising and just watching TV all the time. It's bad for you to do that. So it increases the quality of my life.
So the Life2000 is the non-invasive machine that allows a patient to be mobile. And in fact, it's not really a mask. And I think that's gonna be very important because, hey, what's the point of going out if you can't eat and talk and do the things that make you happy? You know, I've been working with Hillrom for a while, and I just feel that they really do care about their patients. One of the things that gives me comfort is that I know that Hillrom will provide some supportive staff, because it can be overwhelming when you have a device. So to know that they spend time with the patient to explain it, this gives me a little reassurance that, hey, if I recommend this device, that my patient will actually know how to understand it and get the maximum benefit from it. And when we talk about a device that's a portable ventilator like the Life2000, they can walk longer, they can exercise more. And exercise, social interactions, really helps out patients with COPD. So any device, such as the Life2000, that may help patients go do these things, hey, that puts a smile on my face.
Oh my gosh, it was really quite a difference. It was very exciting because he could do so much more. He could last so much longer. You know, with the things that he was doing. We were in a lull for a little while there, and then we got the Life2000, and that brought us back to what we were doing before. It's really improved our lives a lot. It has.
If you have COPD, speak to your doctor to see if the Life2000 system is right for you.
And for more information, you can always visit thehillrom.com/Life2000, and of course, visit our website, thebalancingact.com.